Welcome back to another edition of Get Well Acadiana with Dr. Kevin. Thank you so much for joining me today. Happy to have all of you listening on this fine Saturday morning. This is the show with one purpose, and that purpose is to improve the health of the great citizens of Acadiana. My goal for being here with you every Saturday morning is not just to be an interesting show to listen to, but to change your life by improving your health long term, to show you natural solutions to today's most complicated health problems, and to share some of the amazing advancements in the field of functional medicine and wellness. And I've got a good one for you today. Today's show is going to be about something that plagues so many people out here in the Acadiana area. Today I wanted to have a real serious discussion with you about chronic pain. And you know, chronic pain has many names, and it doesn't matter what you call it. It can be called fibromyalgia, arthritis, migraines, rotator cuff. It doesn't matter what name it has been given. Pain is pain, and not enough is being done to help these people. The truth is, we're not even getting to the solutions to help these people. It's so easy now just to cover this up with medication and ignore it. But that is not a good idea. Opiate addiction has become an absolute epidemic, and I see this every single day in my practice. You know, people seem to think the person that's addicted to opiates is some person down an alleyway somewhere, but that's actually not the case at all. It's the grandmother who just wants to live a better life and be able to go for her walks or do her gardening. It's the dad who had a knee injury in high school football and is suffering with it every day. It's the grandfather who's just trying to walk without limping. If this is you, don't be embarrassed. This is not your fault. I see regular folks every day who are dependent on pain medication and they can't stop taking it. But here's the most absolute frustrating part of this. The pain that you feel is not even what's wrong with you. A symptom is a sign that your body sends you telling you something is wrong. It's not what's wrong, but it's telling you something is wrong. It's like your check engine light on your car coming on, telling you there's a problem in the engine. The light's not the problem. It's whatever's going on in the engine that's the problem. Symptoms are a sign that your body sends you, telling you damage is being done somewhere. So if I touch a hot stove and I feel pain shooting up my arm, I can inject the pain meds in the nerve so that I can't feel it anymore. But that wouldn't make sense because I wouldn't be fixing anything. So symptoms are a sign of a problem, not the problem. We've got millions and millions of people addicted to drugs to cover up a problem because no one has sit down with them and figured out a common sense solution. And just because one doctor can't resolve your underlying condition causing your pain doesn't mean that someone else can. Today I'm going to lay out 5 new technologies for chronic pain and suffering that you've probably never heard of, but are tremendously effective at solving all types of chronic pain. And you know, the other thing that I see all the time is when we start discussing chronic pain, patients don't want to even admit that they have chronic pain. Listen, guys, I've consulted patients. In fact, I've consulted over 10,000 patients in the last 20 years, and I see these patterns all the time. And I'll say, tell me about your chronic pain, and the patient will go, oh, I don't have chronic pain. Well, how long has it been there? 3 months? Well, guess what? You have chronic pain. But people don't want to admit that. You know, one of the biggest problems that I deal with in practice every day, in addition to trying to figure out the solution for these very complex health problems that we treat, but in addition to that, one of the biggest problems that I deal with every day in practice is that people want to take their health problems and make them less than what it really is. We call this minimizing. People use minimizing statements so that they don't have to admit to themselves that their health problems are an issue that needs to be addressed. Oh, yes, I have that, but it's not that bad. Oh, it's not a big deal. It just only happens once or twice a week. I think to myself, well, if your brakes on your car stopped working once or twice a week, would that be a problem? Or they'll say, oh, yes, I just have that because of my job. Well, if that were true, everybody with that job would have that exact symptom. And we know that's not the case. People tell me it's not a big deal. As long as I take my 4 Advil every morning, I don't let it stop me. This is not the pathway to a long, healthy life. Part of my job as a wellness practitioner is to get people to take their health problems out of hiding, and let's take a real look at for what's truly going on with their health. And only then can we actually get to a solution. If we don't realize we have something that's a problem, then we really can't ever sit down and figure out a solution. And what we usually find that someone has multiple things going on, multiple symptoms, and they've been going on for months and months. And everything that they've done has never even attempted to get to the underlying reasons that they have these things in the first place. The truth is, guys, the average patient that comes into us, the average patient that I see, the challenge is not finding out where their problem is. The challenge is that they have so many problems going on in so many different areas that it's hard to even know where to begin. It's not finding the problem. It's that they got so much stuff going on they've ignored, it's hard to even know where to start. And the other unfortunate thing that I see with chronic pain sufferers is what I call behavioral adaptation. Well, doc, I don't plant my garden anymore, and I used to do that, but I can't do that anymore. I used to go dancing with my spouse, but I just can't do that anymore. I'm not able to do that. Oh, I used to go walking with some friends, but I can't do that anymore, so I just stopped. Pretty soon, they'll have adapted themselves out of everything that makes life enjoyable for them. So basically, they're just existing. They're just existing from day to day, and that's no way to live. Especially when there are natural, drug-free solutions out there that can help you with chronic pain. It's just no one has sit down and shown them to you and spent the time to figure out how we can solve these things in your body once and for all. There may also be some of you out there that haven't gotten that extreme yet. Maybe you're having pain you haven't found a solution for, but it hasn't gotten to that extreme. Now is the time you'll want to solve it. Don't let yourself get to the point that it becomes disabling. Structural problems are the number one disabling thing in America in people over 45 years old. And this is why, is because we just don't get to the underlying problems. Don't let it get to the point where you start having to adapt your lifestyle around it or having to cover it up with pain medicine every morning. If you have unrelenting pain and no one has solved it for you, I don't care what the cause is, rotator cuff, arthritis, migraines, whatever it is, I don't care what the pain is. If you've been told you have to live with this, and don't accept that as the answer. We've made tremendous advancements in drug-free solutions for chronic pain, and I'm going to give you several of those amazing solutions on the show today. So stay tuned. You're listening to Get Well Acadiana. I'm Dr. Kevin. We'll be right back after this short break. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you for joining me on the show today. We are discussing chronic pain on the show today. And before the break, we were discussing that your symptoms are not what's wrong with you. Symptoms are a sign your body sends you telling you something is wrong. It's not what's wrong, but it's telling you something is wrong. And treating your symptoms is never going to fix you. So many people talk themselves out of looking for solutions because they've convinced themselves that there's no hope for them. Or maybe they've tried a few things, nothing has worked, so they've just given up. Or maybe their doctor tell them, well, you're just going to have to live with this. It is impossible for any doctor to tell you that you have to live with something. Think about this. that would mean that that doctor knows every treatment available in the entire world and how your individual body is going to respond to each one of those individual treatments in the entire world. It's not possible. I see chronic pain patients every single day. I've never told someone that you're going to have to live with this because I don't know that. I can tell them whether or not my program would help them, but I can't tell them somebody else's program is definitely not going to help them. No doctor should ever say that. And when I say chronic pain for the purposes of the show today, I'm talking about fibromyalgia, headaches and migraines, chronic back and neck pain, shoulder and rotator cuff injuries, wrist and hand problems, knee and foot disorders, disc and spinal issues, knee arthritis, and my favorite, bone on bone. You know, guys, I've heard this. You've heard me say this on the show before. This bone on bone thing is kind of a pet peeve of mine. Listen, I've been in practice for 20 years now, and I think I figured the other day I've done over 480,000 patient treatments. I had the fastest growing practice ever in the state of Louisiana in 1997. I've been rated in the top 10% of wellness practitioners in the country by DSE Enterprises, so I've been around the block. And at least a few times a week, I have a patient come into me and say they have something that's, quote, bone on bone, like their doctor told them their knee was bone on bone. I've heard this hundreds of times. I've x-rayed hundreds of these cases, and in 20 years, I've never found a single one that was actually bone on bone when they've been told that. I'm not saying it doesn't happen. I've never seen it. There's always some cartilage that is there that we can work on and try to get that cartilage to regrow. Because here's the truth. If your joints were really rubbing bone on bone, you would not have walked into the office. It's just silly. I guess the reason they say that is because it's a visual picture and it sounds kind of scary. It's just not the truth, guys. And so that's always been a kind of a pet peeve of mine, this my knee is bone on bone thing. And I'll say, well, let's x-ray it and make sure. I've never found one. So if that's you, just know that there's a chance that we can offer you solutions for that. There's almost always solutions that we can come up with to help someone suffering with chronic pain, no matter what it's from. But the first step is you just have to know that these things aren't normal. It's not normal to suffer with pain, and it's not a part of aging. Pain is not a normal part of life, and it has nothing to do with your age. You know, like the guy I was talking to who came in with his right knee was in severe pain, and he was convinced that it was just because he was old. And everything I would say, he would come back to this, well, it's just because I'm old. Finally, I said, well, tell me about your left knee. Well, the left knee's great. Well, hold on. It's the same age as your right knee. So if your right knee hurts you because you're old, your left knee should hurt you because you're old too. It's not that. It's because you injured it 20 years ago and no one ever fixed it for you at the time. And now it's just gotten to the point where it's starting to bother you every day. So you need to pay attention to these pain problems in your body. You need to address these things now, because if you ignore it, it's only going to get worse. Problems, when you ignore problems, do they typically get better or worse? So like if your house is dirty and you ignore it, is it going to get better or worse? Or if, say your children are doing bad in school and you ignore that, is the problem going to get better or worse? And if you have symptoms in your body and you ignore them and just pop a pill, they're not going to get better on their own. They're going to lead to worse and more expensive and difficult to treat problems down the road. And we depend on these over-the-counter pain medications way too much. This is this class of drugs I talk a lot about called NSAIDs, or non-steroidal anti-inflammatory drugs. That's your Advil, Tylenol, Aleve, that whole class of drugs. These things aren't supposed to be taken for a long period of time. In fact, only a few days. Some of them, the bottle says you're only supposed to take them 7 days in a row. I consult with patients that have been taking them every day for years, and now their kidneys or liver are damaged. So we end up with two problems that we have to fix. One is the original problem they ignored in the first place. And the second one is we have to try to restore their kidney and liver damage, which of course, again, is more difficult and more expensive and more lengthy. So these over-the-counter medicines, people think, well, 2 helped a little, so I'll take 6 or I'll take 8. Or they just adapt their life around the pain. If you're in chronic pain and that keeps you from being active, say from taking your walks, so let's say you have a knee problem that keeps you from exercising. You used to exercise, and if this knee problem prevents you from doing that, that knee problem, guess what, has just turned into a weight problem and a heart problem with cardiovascular issues and a diabetes problem because it's preventing you from staying active. So this can branch out into all sorts of health problems instead of just addressing the underlying issue in the first place. So the rest of your health can begin to go downhill as well. So this is important, guys. Someone needs to figure out solutions for this because life is too short for this. You know, we're only given a certain number of days here on this planet, and to spend a portion of those days, even if it is a few times a week, to spend a portion of those days being less than you could be over symptoms that someone might be able to solve for you and give you your life back is such an unfortunate thing that I see every day in my practice. One of the reasons that I stay so driven every day to change people's lives is because my purpose, the reason I was put here on this planet, is to try to help as many people as possible live a better life using drug-free, surgery-free solutions. And our chronic pain protocol does just that. What I've done with this protocol is I've taken the 5 top technologies for drug-free pain relief and we've coupled them together in one program. So we don't really have to find the magic bullet here. We don't have to figure out the one thing that's going to solve it because usually with chronic pain, it doesn't work that way. We battle chronic pain with a multi-frontal assault, doing these 5 amazing new technologies together in a very specific order in one treatment protocol. This is the reason why we are so successful when everyone else has failed. Trying one thing that doesn't work and then going to the next thing that doesn't work, many times that fails because of the complicated nature of chronic pain. So guess what? If I do 5 things to solve your chronic pain and each one of them only helps you 20%, we're all the way home. We're there. We don't have to hit a home run every time. Or if I do 5 things to help with your pain and 4 of them helps you 20% and one of them does absolutely nothing, we're 80% better. Every chronic pain patient I've ever talked to would love to be 80% better. Most of them would love to be 30% better. But this approach, using today's best solutions and doing them in one really proven program in a specific order based on your underlying condition, will give you the very best hope for permanent relief. And I'm going to go through a few of these technologies right after this short break. But before we cut to break, I would like to invite those of you that are dealing with pain, no matter what the condition is, if you have pain and you'd like to talk to me to see if I thought this protocol would help you, I'd be more than happy to give you a call personally to see if I can help you. I'll call you right over the phone and we can talk about it. If you're taking pain meds, that's okay. I won't fuss at you and I won't take them away from you. And I have a guy that if you're truly ready to stop, I have a guy that can help you with that. But aside from that, we need to get your body fixed first so that you can feel better. And if you're relying on this over-the-counter stuff, that's very damaging as well. So we can also check your liver and kidney function and work on that if that's a problem as well. So if you're interested in talking to me about your individual health problems, I'd be more than happy to give you a call on the phone when I get to work Monday and discuss it with you. If you'll just call my office at 837-7174 and leave your name and number on my machine. Obviously, it's Saturday. I'm not at work today. But when I get back to work Monday, I'll call you personally. It'll be me on the phone, and we can have a discussion about what you're dealing with. And listen, if I don't think I can help you, I won't waste your time. I'm too busy to try to accept patients that I truly don't feel like I can help. But if I do think I can help you, then we'll sit down and we'll figure out a strategy to solve your health problems once and for all. And remember, even if it's not too bad, the sooner we get to it, the better. So if your pain isn't super severe still, don't put it off. Oh, another great way to contact us is that you can text pain to 77453 right now, and that will put my number on your computer, and I'll give you a call back Monday. Yes, we are that tech savvy at Bryant Wellness now. You can text pain to 77453, and it'll show right up on my computer Monday morning, and I can call you. Or you can call 837-7174 and leave your name and number on my machine, and I'll give you a call back Monday when I get to work. It's 837-7174, or text pain to 77453. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me today. We are discussing chronic pain on the show today. So in the time that we have left, I wanted to go through some of the amazing new technologies that we've put in our program to solve chronic pain once and for all. Almost all chronic pain conditions have a few things in common. And yes, I understand every case is different, but generally, most people with pain have a few underlying body conditions that we see the same in almost every case. And one of the main ones that I see, almost every patient with pain that I see come in my office has something called fibrous adhesions. Fibrous adhesions are created from scar tissue. Anytime healthy tissue is injured, the body heals that injury over with scar tissue, and over time, scar tissue can turn into something called fibrous adhesions. Now, if you were to look at normal healthy tissue, and when I say tissue, I'm talking about tendons, muscles, ligaments. If you were to look at normal healthy tissue under a microscope, the collagen fibers would be lined up in a straight line like an interstate highway. This makes the tissue very soft and pliable and healthy. Now, once tissue gets injured, if you look at it under a microscope after an injury, it's not going to be all lined up and healthy looking. It's going to look more like a fishnet. The collagen fibers are going to be crisscrossed in all different directions like a patchwork. This is called fibrous adhesions, and you can feel them under the skin of a painful area. They'll feel like kind of marbly, gristly tissue. Fibrous adhesions are full of pain receptors, and they're a source of great pain in most chronic pain patients. These are those knots that are very tender when you rub or you touch them in your painful area. You know, you can feel like little marbles under the skin that are very, very painful. This is usually the patient that has been everywhere, can't figure out what's wrong with them, and they've been diagnosed with something like fibromyalgia, or just they'll be maybe diagnosed with, well, you just have muscle spasms, something like that. And there obviously has to be a lot more to it than that. Maybe the doctor can't figure out what's causing the pain. Generally, fibrous adhesions are what is the underlying culprit for that. So how does this occur? Well, if you add up all of the very little small injuries that you've had your entire life, each one of those develops a scar, and later that turns into a painful fibrous adhesion. Now, patients often say to me, I haven't had any traumas or injuries. You probably have. The average person has had 1,000 physical traumas to their body that they don't even realize were traumas. Like, they don't even realize they were injured at the time. It doesn't have to be a rollover accident or falling down a flight of stairs to create these fibrous adhesions. People think of traumas as something major happening to their body, but that's not it at all. It's a culmination of all of the little tiny injuries that you've had throughout your whole life will lead you to have fibrous adhesions later on. Maybe in high school football, you were throwing and your shoulder got a little sore. You got micro tears that healed up and then it felt fine. And then maybe in college, you were working out and injured that same shoulder and it was sore a few days and it got better. And then you never thought about it. And then later, maybe later on, you were weed eating your yard and that shoulder got torn a little bit and it was a little bit sore. And then you were lifting something out of the back of your truck and a few months later, it got a little sore again and then it got better. All of these little small traumas over your lifetime will add up to create scar tissue. Then at one point in your life, it's just going to reach a point where it becomes fibrous adhesions and you'll start to produce significant pain in that region. But if you think back, you don't really remember all of those little things. Or maybe in a lower back, the same thing. Maybe you hurt it in high school sports and then later in college and then you were lifting groceries out of the car. Each time it was sore for a few days and then got better. So you didn't really think about that as being a trauma. But all of these little micro tears, these little micro injuries, later on in life, they will lead to fibrous adhesions, and those are a great source of pain. So remember, we have these crisscrossed collagen fibers that look like a fishnet under a microscope. It's like a patchwork of fibers that are tough and gristly and full of pain receptors. Now, the old way of treating these was with trigger point therapy, where we would manually take our thumb and we would apply deep tissue work and deep tissue pressure and manually press these things out of the tissue. First of all, that's very painful because the person's in pain already, and it's a very painful treatment to have done. Any of you that have ever had a really deep tissue massage, you know what I mean. And as you're applying pressure to this patchwork, the other problem is that it's now been found that you actually damage the healthy tissue around it. So you're making that patchwork larger. So you're actually making the problem worse. We have some new technology called rapid release. The way rapid release technology works is through frequencies. Now, if you remember the old television commercial, the best way that I can explain this is that old television commercial where they had a speaker and they had a wine glass in front of it and they turned up the sound and it shattered. If I set a wine glass in front of a speaker and I turn it up loud enough, the wine glass will shatter, but maybe not. The note that you play has to match the frequency at which that wine glass vibrates. If I'm one note too high, nothing happens, no matter how loud it is. If I'm one note too low, the glass will not vibrate and it will not shatter. So the note that's played on the speaker has to match the frequency at which the wine glass vibrates. And this is exactly how rapid release works. Scientists and engineers have developed rapid release, and they've discovered the frequency that breaks up fibrous adhesions. And the rapid release vibrates at the same frequency that can break up this fishnet of tough, gristly, fibrous adhesion. So all we have to do is pass this rapid release over these fibrous adhesions for a few minutes, and it will vibrate at a frequency that will break down these collagen fibers and allow them to become healthy again. It's completely pain-free, and the best part of it is it doesn't damage the tissue around it. It only targets those fibrous adhesions, only the unhealthy patch in there. This is powerful new technology for reducing scar tissue and fibrous adhesions and trigger points. It even works if you've already had surgery, because surgery, when they slice you open, they create a ton of scar tissue. And one of the reasons why patients have so much pain post-surgery is because not because of the surgery, but it's because all the scar tissue from the incisions and sewing things back together. This has been a paradigm shift in the way that we treat chronic pain. And because almost every single chronic pain patient that we look at has loads and loads of fibrous adhesions in whatever their painful area is, This is one of the, remember, with just 5 things, this only has to help 20%. Remember, this isn't everything. But if this just helps 20%, that's one more step in finally solving your chronic pain once and for all. I'm running long, so let's go ahead and cut to break. And I'm going to tell you more about some of these amazing new technologies whenever we get back. But if you want to talk to me about your individual health problems, I'd be happy to call you Monday when I get back to the office and we can have a phone conversation about your particular condition, and I'll tell you what I think I can do about it, or if I don't think I can help you, I won't waste your time. My office number is 837-7174. Just leave your name and number on the machine, and when I get back to work Monday, I'll give you a call. That's 837-7174, or you can text PAIN to 77453. So just go to your text message and text PAIN, the word PAIN, to 77453, and that'll pop right up on my computer Monday, and I'll give you a call back. And if you want to call Dr. Fontenot at our New Iberia office, his number is 367-2567, and I'll be right back after this break as long as my voice holds out. Stay tuned. Welcome back to Get Well Acadiana with Dr. Kevin. We're discussing technology to treat chronic pain today. And before the break, I was discussing some amazing new technologies to treat chronic pain called rapid release. And one of the things with our protocol is that we treat chronic pain from a multifrontal approach. It's not that we just try one thing and we hope that one thing works. If I do 5 things to help with your chronic pain and each one of them helps 15 or 20%, we're all the way there. If half of them help 20%, we're 50% better with your chronic pain. And so we don't have to hit a home run. We just put together a comprehensive strategy on some of today's very best technologies to treat chronic pain. And if each one of those helps you some, then when we add up the culminating effect of all of those things, well, pretty soon the patient is doing amazing, usually better than they ever have for their chronic pain. So before break, we were discussing rapid release. The second really powerful new technology that I wanted to tell you about today for chronic pain patients is called dry needling. Now, I'm not crazy about the name. I would have named it something different than that. I mean, if you go to the average person on the street and say, hey, would you like to be dry needled? I don't think very many people are going to say yes. But Dr. Fontenot and I are both licensed dry needling practitioners. And if I were to ask you, why do people get pain that doesn't go away? So in other words, the question is, what's the difference between acute pain and chronic pain? Well, with acute pain, you hit your elbow on something, it hurts for a little while, and then it goes away. With chronic pain, it does not go away. It stays there. Why is that? Well, here's what happens in the body. Your body's response to pain, your body has a reflex to pain called splinting. Splinting means that anytime your body feels pain, its automatic reflex is to protect that area, so it contracts and spasms all the tissues around that in order to protect that tissue from further injury. Splinting is the same reason when you smash your thumb with a hammer, you hold it next to your body and wrap your other hand around it. You hold it tight to your body. That's a reflex called splinting. Your body actually does this all over, every part of your body that feels pain. So when your body goes into this pain, the muscle spasms and tissues around it contract as a protective mechanism. Now, the bad part of that, though, is that sometimes when this area contracts too hard, it can push the blood flow out and it restricts circulation to the area. But the blood is what contains all the oxygen and healing chemicals that it needs in order to stop hurting. So when it contracts hard enough to push the blood supply out, that painful area doesn't get the oxygen and healing chemicals that it needs to feel better. So it begins to hurt worse. So then it contracts harder, and that pushes more blood flow out. developing even further oxygen deprivation and lack of healing chemicals. So it begins to hurt worse. So it contracts even harder and it pushes more blood flow out. And now you've got this downward spiral of muscle spasm, contraction, and pain. The body's own splinting mechanism has robbed this painful area of exactly what it needs to feel better. The body's protective mechanism has responded so well that it has robbed this painful area of exactly what it needs to actually resolve the problem in the first place. The area then becomes chronically painful. The muscles are stuck into contraction and spasms, and the body is basically just stuck there, doomed to hurt worse and worse and get tighter and tighter. Now, in dry needling, we take these tiny acupuncture needles and we begin to insert them around these spasms and contractions, and it actually reverses and relaxes this whole process. The body will begin to bring more blood to the area, more oxygen to the area, washing out even more waste products and lactic acid buildup from the spasm, bringing in more oxygen to the tissues and all of the healing chemicals that the body needs to heal. So you begin to get this exchange of oxygen and healing chemicals to the painful area and washing out all of the buildup of lactic acid and waste products from that spasm. A spasm, the reason that if you have say a back spasm, the reason that hurts is, imagine if you took a weight and you just held it in one place for as long as possible. That muscle is going to begin to hurt. That's the lactic acid buildup. And in this splinting mechanism and chronic pain, that just gets stuck there, sometimes for months or even years. But it's this exchange that we begin to reduce pain and to break this spiral of spasm and contraction. And Dr. Font and I both are licensed in this dry needling procedure. I've literally seen patients stand up off of the table that have been suffering in pain for years and begin to immediately feel better, even after years of suffering, because we've broke that body's reflex mechanism that's had them stuck in chronic pain. Now, for those of you that are afraid of needles, these things are tiny. They're actually about the width of a human hair. They're right about 1/3 the size of a mosquito bite. But I've been doing this 20 years, and I've seen this help more patients with chronic pain than anything else. It is truly a remarkable advancement. Now, there's only a few elite physicians that are doing this in the Acadiana area. Dr. Fontenot and I were fortunate enough to study under Dr. Yuntao Ma, who's a world-renowned practitioner who teaches in Europe and all over the other parts of the world. And so we learned from the very, very best. Well, guys, I'm running out of time today, but before we go, if you're interested in talking to me about your health problems, I would be happy to call you back Monday when I get to work and discuss your health problems with you. And if you call my office at 837-7174 and leave your name and number on my machine, when I get to work Monday and I get some time, I'll call you back and discuss your health problems with you over the phone and let you know if I think I can help you and if it would be worth your time. And if I can't help you, I won't waste your time. The number's 837-7174, or if you just have your phone handy, you can just simply text PAIN to 77453, and that'll pop right up on my computer Monday, and I can give you a call back. And so that's text PAIN to 77453. And Dr. Fontenot is amazing as well at our New Iberia location. His number is 367-2567. I have so many more amazing technologies that I wanted to tell you today about chronic pain. And so I tell you what, let's do this. I'm going to do a second show next week on this for you guys, just simply because I ran out of time today. And so we will have chronic pain part 2 next week if I'm able to fit that into my show schedule. Thank you all so much for joining me on the show. Don't suffer with chronic pain. Life is too short. We're only given a certain number of days here on this planet, and to spend those days being less than you could be because you're suffering with pain, if it keeps you from playing with the grandkids or if it keeps you from going dancing with a spouse, that's such a shame. So don't give up. I truly want to help each and every one of you out there feel better and give you your life back. The number's 837-7174, or simply just text PAIN to 77453. Have a great weekend. We'll do chronic pain part 2 next week. Thank you for listening.